Scano, Sago, and welcome, one and all, joining us on the doorstep of the weekend. Please allow me to welcome you to the June 26th edition of our Six Nations COVID-19 podcast. I'm Lori Davis-Hill, Director of Health Services and COVID-19 Incident Command for the pandemic response while our state of emergency remains in place. It is close to the weekend. Let's get a little closer by beginning our podcast and see who we might be visiting with in our wellness area. So everyone give a warm welcome to Dr. Melissa Shigwadja, family physician with the Six Nations Family Health Team, joining us today. Scano, Melissa, what is your role at the Family Health Team?
Hi, thanks for having me today. I'm Dr. Shigwadja, and my role there is to provide primary care.
Great, and what information would you like to share with us that might help us take care of ourselves?
So June is Stroke Awareness Month, so I'd like to share some information about stroke with you today. So a stroke happens when blood stops flowing to any part of your brain, damaging brain cells. The effects of stroke depend on the part of brain that was damaged and the amount of damage done. There are different types of stroke, and each comes with different risk, causes, and treatments. These include an ischemic stroke, which is caused by a blockage or clot in the blood vessel in your brain. The blockage can be caused when plaque builds up on the inside of an artery and breaks free. Then there's hemorrhagic stroke, which is caused when an artery in the brain breaks open. The interrupted blood flow causes damage to your brain, and it's actually high blood pressure that weakens the arteries over time and is a major cause of hemorrhagic stroke. Then there's also transient ischemic attack, TIA, which you've probably heard of. This is caused by a small clot that briefly blocks an artery. It is sometimes called a mini stroke or a warning stroke. Sometimes it will last less than an hour, but may only last a few minutes. TIAs are important warning that a more serious stroke may occur, so this is a medical emergency as well. So do call 911 if you have symptoms.
So can you share what these symptoms are of stroke?
Sure. So an important way that we can help ourselves and our loved ones is to learn symptoms of a stroke. The symptoms usually come on suddenly, so just think of the word FAST, F-A-S-T, where each letter in the word stands for one of the things you should watch for and what you should do about it. So F stands for face. So does the person's face look uneven or droop on one side? A stands for arm. Does the person have weakness or numbness in one or both arms? Does one arm drift down if the person tries to hold both arms out? S stands for speech. Is the person having trouble speaking? Does his or her speech sound strange? And then there's T. That stands for time. If you notice any of these stroke signs, call 911. You need to act fast because the sooner treatment begins, the better the chances are for recovery. There are also other symptoms outside of the acronym that can be signs of a stroke, and these include trouble seeing in one or both eyes, trouble walking, and loss of balance or coordination.
You talked about treatment. How are strokes treated?
So the right treatment depends on the type of stroke you're having. It's very important that you get to the hospital very quickly to figure this out and call 911 to get there. People whose strokes are caused by clogged arteries can get treatments that reopen the arteries. Also medication that prevents new blood clots. For those whose strokes are caused by bleeding, they can have treatments that reduce the damage caused by bleeding in or around the brain. They might also have to stop taking medications that are causing the bleeding or take that medication but at a lower dose. Or they might need surgery or procedure to treat the blood vessel to prevent more bleeding.
I know that our paramedics are very proactive when it comes to helping someone who's experiencing strokes. Can strokes be prevented?
Absolutely. So prevention starts with knowing your risk. 80% of premature stroke can actually be prevented with healthy behaviors. So you can greatly reduce your risk of having a stroke by seeing your family doctor regularly to manage your high blood pressure, cholesterol, and diabetes, which are all risk factors for stroke. Making sure that you take your medications exactly as directed. Some of these medications that are important in preventing strokes include blood pressure medications, cholesterol lowering medications called statins, medications that prevent blood clots, such as aspirin or other blood thinners, and also medications that help your blood sugar stay as close to normal as possible if you have diabetes. There's also lifestyle changes that you can make to prevent stroke. So stop smoking if you do smoke. Get regular exercise, at least 30 to 60 minutes a day. Lose weight if you're overweight. Choose plant-based foods such as fruit and vegetables, whole grains, nuts, legumes such as chickpeas, lentils, or black beans. And limit or avoid eating meats, sweets, and refined grains such as white bread or white rice. You also want to eat less and limit your salt intake, and limit the amount of alcohol you drink. So if you're a woman, you do not want to have more than one drink a day, and if you're a man, you do not want to have more than two drinks a day. Another thing you can do to prevent stroke is to identify your source of stress and make steps to manage it. So be physically active, talk to your friends or family or even a counselor, and try to be sure to build enjoyment into your life. Another way to prevent strokes is there's a type of surgery or procedure that's used to reopen clogged arteries in the neck. This treatment, though, is more appropriate for a smaller group of people with this particular issue. But of course, there are also risk factors that you cannot control that you should be aware of. One of them is sex. So the risk of stroke increases after menopause in women. Age, the older you are, the higher your risk of having a stroke. Family and medical history. If you have close relatives who experienced a stroke or TIA at an early age, then that makes you at a higher risk. Indigenous heritage. So First Nation, Métis, and Inuit people are more likely to have high blood pressure and diabetes, and we are therefore at greater risk of stroke than the general population. There's also people of South Asian and African heritage. Very similarly, they have high blood pressure and diabetes and other risk factors for stroke at a young age. And then there's also personal circumstances, along with environmental factors that can influence your health. These can include access to healthy food, safe drinking water, health, and social services.
What happens after a person has a stroke?
So some of the most common long-term problems that can be caused by a stroke include speech problems. So people who have a stroke sometimes can't speak anymore, or they can't understand speech. There's also weakness and movement problems. You may have muscle weakness or paralysis on the left or right side of the body, and this can affect your face, arms, or legs. You can also have trouble walking, grasping objects, or balancing. There's also partial loss of sensation. So you sometimes have partial or total loss of feeling on the left or right side of the body. There's also trouble eating or swallowing. Sometimes this problem causes food to go down the wrong way and into the lungs. This is very dangerous because it can lead to lung infections such as pneumonia. There's also problems thinking clearly or interacting with others. You may get easily confused or have trouble staying focused. You can also have personality changes that make you react differently to others. Another common issue is depression. So people who have stroke sometimes get depressed. This can make recovery even harder. It's sometimes, it's important that this does get treated after having a stroke. There's also problems with bladder control. So people who have had a stroke sometimes cannot control their bladder, or they might leak urine, but this often gets better over time.
So what kind of things happen during recovery from a stroke, and what kind of help can people have during that time?
So during recovery, people usually engage in stroke rehabilitation. This is where people will work to regain some of the abilities that they lost. So even though part of the brain was damaged by the stroke, your brain can actually relearn how to do some of those things that it used to do, such as walking, talking, communicating. During stroke rehab and recovery, you will also learn how to cope with problems caused by stroke.
Yeah, and we have the disciplines here, such as physio, occupational therapy, speech pathology, who can assist folks as well. And I know the Family Health team also has a social worker if that becomes an issue for families. I really appreciate you joining us today, Dr. Shigwadja. And stay safe, and you and your family have a great weekend.
Great, thanks for having me.
So as we noted, we're about to head on into the weekend, so let's see what the numbers for the past week are saying. Since our last talk on Wednesday, the province is still recording new COVID-19 cases under 200. Yesterday was a slight uptick with 189 new cases, so we'll continue to monitor those numbers over the weekend. This Friday here at Six Nations, our numbers have remained steady at 14 cases of COVID-19. 0 cases are currently considered active. At our testing facility, 919 people have been tested. 881 of those results have shown to be COVID negative. Results of 24 tests are yet to be received. We presently have 18 individuals self-isolating under the direction of Michigan Public Health. Today, a few more regions of Ontario have been given the green light to progress to the stage 2. However, areas in and around Windsor remain at stage 1. Let's look at numbers for other local communities. Mississaugas of the Credit remain at 1 resolved case reported. Haldeman Norfolk Public Health Unit reports 446 total cases, 228 are active, 186 are recovered, and 32 deaths. Brant Public Health Unit reports 121 cases, 3 cases are active, 114 are resolved with 4 deaths. Hamilton Public Health Unit reports 819 cases, 727 are resolved and 44 deaths. The Toronto Public Health Unit reports 14,094 cases, 897 of which are active, 12,127 are resolved, and a total of 1,070 deaths. With stores, salons, malls, and patios opening up, you do have the right to enter and shop and utilize their services. However, now is the time to do so responsibly. Please adhere to public health guidelines. Please monitor yourself and even those around you. Please ensure that as more things start to open up, that COVID-19 does not become a guest that winds up moving in with you and your whole family. The quickest and easiest way to settle all doubts in your mind about COVID-19 is to get tested. There is no cost, it's simple, easy, and free, and you'll be welcome to a test even if you have only simple or mild symptoms. The Six Nations COVID-19 Assessment Center is available to Six Nations community members by appointment only. Please call 226-446-9909 or toll free at 1-855-977-7737. If you are symptomatic and awaiting test results, you will be asked about your activities over the past 2 weeks, and specifically the last 48 hours before we start to have symptoms. We should all stay aware of where we go and who we see, because if we do get sick, this information will help us to identify where you might have picked up the virus and where it might have spread. We are still in an active pandemic, and the spread of the virus has not yet stopped. Keep Six Nations healthy and moving forward by wearing a mask in public, keeping the physical distance, washing your hands frequently, avoid touching your face, and clean high-touch areas often. Yes, those masks will protect. They protect the both of us, so let's make sure we are all wearing them. Some of us like to write ourselves notes, so we put by the door or on the doorknob to remind us things we have to have before we leave for the day. So why not put "wear your mask" as one of those notes? So as we wind things up and head into our weekend, just remember we all know it's hot out. And for those of you who are thinking of a weekend get-together, remember to keep gatherings to a 10 people maximum, preferably only those 10 people who you interact with as part of your social bubble. If you are joining each other, bring your own party supplies, pop, cups, food, sanitizer, and towels. Make a bundle so just you use it and explain that you're not being an unwelcome party host, you're being safe host, so that you take care of all and you can have more gatherings as summer rolls on. Do not wear other person's swimwear, share goggles, snorkeling masks, or anything that other people may have touched. Remember to watch Six Nations Matters and Healthy Six Na on Facebook for virtual online programming being offered, including virtual summer camps. And if you would like to connect with the Six Nations Mobile Crisis Service, you can do so by phone at 866-445-2204 or 519-445-2204. That's available 24/7. By text, you can reach them 8:30 to 4, Monday to Friday, at 226-777-9480, or by live chat, Monday to Friday, 8:30 to 4, and you can see that on the Six Nations COVID-19.ca website, along with a lot of other information. The podcast will be back Monday with a special guest host for a new round of guests, numbers, and wellness tips. Please remember our frontline workers here in Six Nations and around the world. Please stay home for them. Please stay home for all of us. Stay well and stay safe. Nyawa.